National Orthopaedic Hospital, Igbobi. It was established in 1945 as the Royal Orthopaedic Hospital for returnees from the Second World War, for recuperation, treatment, rehabilitation. We are mainly an orthopedic institution. 80% of our activity is orthopedics. About 40% of our patients need MRI. For patients coming from outside, it's not so much of a problem, but we have patients who are inside, who we have to admit and then send for MRI, so it becomes cumbersome. So on a daily basis, one of our ambulances has to take patients out to go and do an MRI and bring them back. So patient is going, our ambulance is tied down, he has to wait for the patient to finish the MRI. A nurse has to accompany the patient because the patient is still our patient. If anything happens in transit, we're liable. So it's part of our services that is missing.
When we wanted to start the public-private partnership in Igbobi, we were looking for the funding. Unfortunately, in our country, most of the banks don't do medical. And most of them don't even understand what you want to do. So that was a big challenge until we came across MCF and PharmAccess. These are a group of professionals and they know healthcare inside out. They were the first set of people that will understand our need. They funded the construction, and that's where the partnership is building up.
A couple of years ago, we supported Crespi Radiology, Dr. Fatade, to help upgrade his facility by giving him a loan through the Medical Credit Fund up to the extent of building the infrastructure around his diagnostic center.
The orthopedic hospital had provided space, land for them to use, so the rest was up to them to come up with the finance. In that process, we were able to give him the phase 1 financing, which was to build the facility, did all the architectural, engineering, and civil work, and then came up with this beautiful edifice that we had the center. And now the phase 2 was actually to equip, because the building without the necessary equipment was not valuable to the hospital.
They treat most of the orthopedic patients, the accidents, the really complex cases in Lagos State. Believe it or not, they didn't have an MRI machine. They didn't have any equipment that could properly diagnose, the broken bones and do the radiology.
For an orthopedic hospital where you deal with the bone, you must, first of all, diagnose where the problem is before you start to treat. And so we've seen a lot of bad cases, bad outcomes, because essentially physicians were flying blind.
This is where MCF came in. MCF provided the funding that helped to acquire the MRI machine. So as of today, I'm happy to say that Igbobi Hospital has a functional MRI machine. They don't have to take patients with broken bones out of their premises to get diagnosed outside or to do the required radiology testing.
One of the things that makes us unique as an organization is that we have nothing to gain except ensuring that the least people in society have quality healthcare service. And we're very passionate about making sure that healthcare is affordable to the least people that actually require it. And so one of the things we're trying to do is to be a convener of some sort, to bring relevant people to the table to say, how can we solve this problem that plagues us as a country? How can we, leveraging on existing infrastructure and the systems that are in place, improve the ability of people to access healthcare?
So this is what kind of PharmAccess and the Medical Credit Fund set out to do. To provide funding, to provide loans at a competitive interest rate that would help healthcare facilities improve the quality of care that they give.
That is where I give kudos to them. Without a company like MCF and PharmAccess, I doubt whether most healthcare practitioners will be able to do most of these things. Now that the MRI is within the hospital, it's easier for them to access this. it's easier for the doctors to be able to treat them promptly. It will increase the patient's flow. It will improve also on the practice of the profession itself. And for the patient, you can come in and within a short period, you can go back home. You've had your MRI done, you've seen your doctor, he has reviewed it, so your waiting time is shortened.
So what PharmAccess has done is to bring services closer to the patient, and it will help the hospital provide more services to many more patients in the near future. So basically, it's a win-win situation for everybody, for PharmAccess, for the hospital, for the government, for the patients.